I'm making a awareness video about dog bites and sometimes even cat bites also, because I frequently encounter patients who are who are coming with dog bites. Sometimes they play with their dogs at home and then the dog bites them or scratches them, and sometimes street dogs bite them, or street cats bite them or scratch them. So every patient have few sets of questions to me, so I thought I can give clarity online also. It might help everyone. So the first question is what I should do after a dog bite or a cat bite. So what you should do is you should open the tap water. In running tap water, use a soap and keep on washing the affected area with the soap for 20 minutes. This is the first thing anyone should do whenever there is a dog bite or cat bite. Let it be a scratch, let it be a bite, let it be a bite with clear mark, let it be a bite with blood around it, whatever it is, deep bite, anything. So you first wash it. So washing itself will remove the surface harmful microbes. So that is one thing. Because dog bites or cat bites, they will have in saliva there will be microorganisms, in nail there will be microorganisms. You might get infection from that. So that is the first thing you have to do. Then, what mistakes patients do at this point is some patients tie, like in snake bite, they tie some cloths or sometimes even ropes they tie in their hand and tighten it. Wherever the bite area, just few centimeters above it, they tighten it. Don't do that. And sometimes they use a cloth and they make a firm pressure and then they make a like a dressing, they make it like that. Don't do that. So first thing you have to do is washing the area. That is step one. So remember, open the tap water, running tap water. So keep your hand or leg wherever there is a bite. So keep on washing it. The most common bites I have seen usually occurs in legs. So that is one thing. So second thing, you need to know about the dog. That is the second thing. So about the dog, what you need to know is it, if it is a home dog, you need to know is it vaccinated or not. That is the first thing. Second thing, if it is a home dog, you need to know is it vaccinated or not. If it is a home dog, you should know why the dog is biting. Like it's called intentional or non-intentional bite. So intentional bite is, for example, the dog is simply playing, so you are going attacking the dog, so to defend itself the dog is biting you. Or the dog is simply sitting, you are just trying to move the dog, you're just trying to do something to the dog is biting you or scratching you, anything. So it is intentional, like you are disturbing the dog and the dog is doing something harm to you. So that is intentional. Non-intentional is you are idle and the dog comes and bites you, or the dog comes and scratches you. In non-intentional, anytime non-intentional should be considered like, okay, this dog is a rabies dog. You should think in that mindset only. Not always the dog is a rabies dog, but anyway, you should think like that in your mindset. So intentional bite is you're doing the harm. So usually for intentional bite, usually you do not require ARVs injections. So that is one thing. And usually non-intentional harm, like the dog comes and bites you, it is better to get ARV. That is one thing. So ARV is anti-rabies vaccine. So that is point number two regarding home dog. And regarding street dogs, with intentional or non-intentional, always you should be careful. So how I will know, like should I require vaccine or not? That is the third point that I want to tell my patients, everyone. So dog bite is of three categories: category 1, 2, and 3. Category 1 can be without any skin harm, like a lick, a dog's lick, normally licking. So usually this happens in home dogs only. When you are playing with the dog or the kid is playing with the dog keeps on licking the kid or you. So that is one thing. So usually for licking, nothing is required. So this is a very common question asked by my patients. So a dog licked my child, should I give ARV? No, not required. And second point is category 2. Category 2 is any bite or any scratch where your skin is not damaged, blood is not exposed. Skin damage will be there, but you cannot see much, and blood is not exposed. So when there is no bleeding, it is category 2. So there can be a bite, so you can see the bite mark, but there is no blood around it, it is category 2. When there is a scratch, you can see the scratch mark, but there is no blood around it, it is not it is category 2. So for category 2, anti-rabies vaccine is required. In the same scenario, you have to open the running tap water, wash your hands for 20 minutes, and then go to your doctor, get yourself ARV. So, and obviously tetanus if required, that is based on your tetanus history, tetanus vaccine history. So let's keep that point aside. Now we are talking only about the rabies vaccine. And category 3 is any bite or any scratch where there is blood involvement. So there is a deep, not necessarily like a very deep bite. Even there is a small bite but blood is exposed, it is category 3. So big bite obviously category 3, big scratch automatically category 3. So for category 3, vaccine is required along with something called immunoglobulin. Immunoglobulin is where there is affected site, there injections will be given. That is immunoglobulin. So these are the 3 categories. I'm telling this now so that patients before going to doctor, at least they will have some idea, they will be prepared enough to know that okay, for this type of bite I will require vaccine, it is a serious one, I definitely have to go to doctor. It is only for awareness, because many people still think okay, it's just a small bite, there is no much blood, it is okay, I can ignore, and then they just go to work. These are the patients who end up getting rabies. So I'm not going to talk about the rabies, its signs, its symptoms, all these things now. So all I'm saying is this is just precautionary measures what you should do, and this is just to let you know, like should you require a doctor or not, should you require a vaccine or not. It's just a basic information. And for safety, anytime any bite, any scratch marks, if you are in doubt, please visit a doctor. I hope this information helps. Thank you.